now. Alright, for some reason the camera stopped, so right now we're going to go ahead and restart the musculature system. Can you please lay down? I'm going to go ahead and do the range of motion for the hip. For the hip, we're going to be, I'm going to have you bend your knee, and this is flexion of the hip, okay? I'm going to have you bend the other one, flexion of the hip, okay? Then I'm going to have you swing your leg out. This is external rotation of the hip. Then bend your knee right here, turn it the other side. This is internal rotation of the hip. We're gonna do the other one. We did the flexion. I'm gonna have you swing your. That's external rotation, internal rotation. Okay. For the hyperextension, when you stand up, can you come back here, please? Okay, so now we're gonna start with no, can you sit down please, I'm sorry. So, we're gonna do the neck. I'm gonna have you turn to the left and turn to the right, like rotation. That's a rotation. That's a rotation of the neck. Then I'm gonna have you bend your knee. That's lateral bending to the left and to the right. Okay, flexion, hyperextension. Okay, and push. This is for strength. Push against my hand. Push against my hand. Okay, for the shoulder, I'm gonna have you stand your shoulder like that. Push against my hand. Okay, then I'm gonna have you have your shoulder above your head. That's up. That's abduction.
Mm-hmm.
Then to the front. That's abduction. Okay. External rotation. I'm gonna have you have your arms above behind your head. Yep.
Mm-hmm.
Okay. That's external rotation. What you just did now. Then I'm gonna have you have your behind your back. That's internal rotation. Okay. Now we're gonna move on to the elbow. For the elbow, I'm gonna have you bend your elbow. That's flexion, hyperextension, flexion, hyperextension. I'm gonna have you, that's supination. Turn your palms down. That's pronation. Open your fingers. That's flexion. No, that's hyperextension. Hand like this. That's flexion, okay? I'm gonna have you squeeze my hand. This is we're checking for the strength. I'm gonna have with your elbows. I'm gonna have you push against my hand, okay? That's for the strength of the elbows. For the knees, I'm gonna have you oh, I forgot. You know, when you was laying down, I should have checked for the strength of the hip.
Mm-hmm.
So what I'm gonna do, I'm gonna have you. I'm sorry. I'm gonna have you lay down again.
Yeah.
I'm gonna have you push against my hand. Go ahead and push. That's for the strength of the hip. Again, go ahead and push. Okay. Can you turn back here, please? I'm so sorry.
No.
For the knee, I'm gonna have you. Yes, that's hyperextension. Bend it. That's flexion. Same thing for here. Hyperextension, flexion. Can you go ahead and push against my hand? That's for the strength of the knee. For the ankles, I'm gonna have you up and down, like point your foot up, point it down. Okay, this is flexion, hyperextension. For the same thing here. I'm sorry.
Okay.
Flexion, hyperextension, flexion. Can you push against my hand? Okay. For the foot, I'm gonna have you turn your foot right here. That's eversion. That's inversion.
Mm-hmm.
Eversion.
Inversion.
Inversion. Okay. Alright, for the vertebral column, I'm gonna have you stand up. And I want you to bend and touch your toes. Okay? Alright? And of course my patient is not at risk of fall. She's young, she's standing straight. For the okay, so I want you to like walk back, like just like kind of, yeah, go back. We are this hyperextension of the hip that we're checking now. Hyperextension of the hip. Okay. And I think we did. Okay, that's about it for the musculature system. Okay, now we're gonna move on to the neuro. I'm gonna have you sit down, and we're gonna do different tests with the neuro. We're gonna check for sensation, for discrimination, for the coordination, deep tendon reflexes for the upper extremities and the lower extremities. And there's different tests that we're gonna do for the sensation. I'm gonna have you this for the pain sensation and for the touch sensation. I have a cotton ball, okay, and I'm gonna touch you with this cotton ball. And this is how cotton ball feels. I'm gonna have you close your eyes, and I'm gonna touch you in a random different areas in the body, and you let me know if you feel it, okay? Say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
Okay. All right. Then we're gonna do the pain, the touch for pain. This is how this is the hammer object hammer. So I'm gonna touch you. This is how sharp pain gonna feel, and this is how a dull pain gonna feel. So I'm gonna go ahead and touch you randomly, and you're gonna tell me which, like, is it dull or sharp, okay?
Sharp. Sharp. Dull. Dull. Sharp. That's sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Dull. Sharp. Sharp.
Okay. All right, now we're gonna do a vibration test. I'm gonna activate the fork, and I'm gonna touch you in different bony areas, okay? And tell me when you don't feel it.
You feel it?
When you stop
Oh,
feeling
when I
it.
stop
Yeah.
feeling it.
Actually, you just tell me if you feel it.
I'm feeling it. Yep. Yep.
Okay. All right. Now we're gonna move on to the discrimination test. Okay, I'm gonna have you for the discrimination test. I'm gonna have put two different objects in your hand. I'm gonna have you close your eyes and tell me where is this objects are. Okay. All right. So here we go. Tell me what they are. And we are testing here. We are testing for stereognosis.
This is a coin
Uh-huh.
and a paper clip.
Yep. Get that right. Then we're gonna test for graphesthesia, and I'm gonna have you close your eyes. I'm gonna write a number, and you tell me what it is in your hand. Okay.
6. Do that again.
For the joint position, we're gonna check. I'm gonna have you close your. Okay, open your eyes. This is up. This is down. This is neutral. Okay. When I'm gonna have you close your eyes, and I'm gonna point your finger to a certain direction, and you let me know which direction. Okay.
Mm-hmm. Up,
Okay. Hold on.
down,
Did I hurt you?
up, neutral.
Okay. Camera here.
Up, down,
Okay.
up, down.
Okay. Now that we did the discrimination test, we're gonna do the coordination test. And the coordination test, it's finger to nose, nose to finger. Okay. First of all, we're gonna do finger to nose. What I'm gonna do, I'm gonna have you have your arms like this, and I'm gonna have you touch your nose with both hands. Okay.
Okay.
Touch your nose. Okay. Close your eyes and go fast. You should be doing. Okay. All right. Open your eyes. Open your eyes. Now I'm gonna have you touch my finger and touch your nose. All right.
Touch your finger.
Mhm. And touch your nose. Go ahead and do it. Touch my finger, your nose. My finger, your nose. Okay. Now I'm gonna have you do the rapid hand alternating. Basically, you're gonna go like this and fast as you can. Okay. That's what we were checking for coordination, okay? And then we're gonna check for deep, and this is the funny part, deep tendon reflexes. We're gonna check for the biceps,
Mhm.
triceps, and I am gonna be doing the triceps first, biceps first, and then triceps and brachioradialis. Okay, so for the tricep, I'm gonna hit right here. So, see, it is so awkward to be here. I'm gonna try to face the camera right there. Okay, the other one. You are hyper. Then we're gonna do the triceps, which is this one gonna be very hard to do. Can you just like kind of turn? Okay.
Which way do you
No,
want me?
you sit down.
Oh, sit.
Yeah, but I want your arm to. I'm sorry. Just like. I'm just trying to hit the right spot. Okay.
This way.
Mhm. I hope I hit with the right spot right here. Okay, perfect. That one was good. Okay. Then we're gonna do this right here. The brachioradialis. We should see some jokes. Okay. Okay. Then we're gonna move to the lower extremities, the tendons, reflexes for the lower extremities. It's gonna be the patella, and Achilles. Okay. All right, so I'm gonna be. Can you just go ahead and sit like?
Let me lower this.
Okay, so. Or can you like hang? So it's gonna be right here. Okay, I see the jerk of the foot right there. Okay, and you should push. Oh, I'm sorry.
I felt that.
Okay. Alrighty. And the Blavatsky, what I'm gonna do, I'm gonna kind of like, we're gonna have to face the camera here for the Blavatsky. Yes. And I should see if it's gonna be abnormal, your toes is gonna be, this one gonna be pointing up and this one gonna be like open spread. but if it's normal, you're gonna be. If let me know. Are you
Ticklish?
ticklish?
A little bit.
Okay. So I'm gonna say I'm gonna like go all the way. You're not ticklish. Do you feel it?
Yeah.
Okay. Okay, that's normal what you just did. Alright, now we're gonna move to the test of testing your, I'm just testing your sternum notch.
You wanna put the camera up?
I'm just gonna point the camera up higher a little bit so. Okay. I'm sorry. Okay, that's perfect right now. For the gait, we're gonna check the balance, and I'm gonna just gonna push like on you a little bit, so you look like you have a good balance. Then I'm gonna have you stand up, and I'm checking for the lumbar test. Close your eyes. Do you feel dizzy or anything? No? Okay. Okay, perfect. I'm gonna have you walk right here and take some like normal steps to the front. Don't go away from the camera. Turn back, turn back. Come back here. Perfect. Then I'm gonna have you do the tandem test, and what it is like you're gonna walk with your foot in front of your toes. Take a few steps. Perfect. Okay, that's a regular. Okay, then you're gonna walk on your heels. Then you're gonna walk on your toes. Walk.
I can fall right.
Yeah. Okay, perfect. And that's about it. We finished the test, and we had some technical issues with the camera, but okay, thank you so much.